Welcome to the UK Made Easy podcast, where we help aspiring international medical graduates like yourself achieve their dreams of passing their PLAB 2 and practicing medicine in the UK.
Hello and welcome to the UK Made Easy podcast. My name is Nada, and tonight I'll be talking to you about one of the main pillars of history taking, signposting. So to start off, let's dig deeper into what signposting actually is. If you want a clear-cut definition, it's basically exactly what it sounds like, a signpost, a memo, a warning. But how exactly is that related to a medical consultation, right? Well, it's widely known that as a doctor, sometimes you're required to pry through a patient's life, through medical and non-medical issues, past and present, to get a 3D picture of the condition you're currently dealing with. You have to explore your way through, look for risk factors or maybe contraindications to a certain line of treatment, stuff like that, right? But does the patient always know that? Do they just bust the doors to their personal lives wide open for you without hesitating? Of course not. That's why we implement what we call signposting. You have to inform the patient or warn them that you're going to be asking about something that might seem unrelated to their original complaint, or frankly might be a bit embarrassing, or else they'll automatically get skeptical of you. In fact, in OSCE exams specifically, it's standard that if you ask sudden personal questions, you'll always get the famous reply, Doctor, I'm not sure how that's related to my chest pain. Completely awkward and unnecessary. Okay, so why do we signpost? What are the benefits of signposting? We always like to refer to that part as we signpost to get rid of sign, in letters, S-I-G-N. Now the S is basically surprise. Of course, our number one aim is to lose the element of surprise so the patient doesn't feel awkward or wonder why you're butchering his privacy, right? Basics. Now the I stands for insecurity. Sometimes in OSCE exams, you face patients who are quite insecure about the problem they have and they're reluctant to speak up, like for example in domestic abuse scenarios. If you signpost the right way and make the patient feel comfortable, they're bound to open up to you rather quickly, and that's another benefit.
Join the UK Made Easy online academy and put your hands on exclusive videos detailing over 300 PLAB 2 scenarios with easy-to-follow notes that contain the latest NHS guidelines. In addition, you get access to take part in our regular member-only group mocks where we put our heads together and discuss common pitfalls and challenges. Book your spot now at www.ukmadeeasy.net/courses. That is www.ukmadeeasy.net/courses.
Now the G here stands for guilt. Why? Because in some cases, the patient knows that he's doing something you're unlikely to approve of, so he flat out lies to you. For example, if you're asking about recreational drugs, if you just out of the blue ask him, do you do any drugs? He'll definitely tell you, no doctor, of course not, what are you saying? But if you go with, John, I'm going to ask you a couple of questions about your lifestyle now. Things that might be related to your condition. Do you smoke? Doctor, I used to, but I stopped. Aha, that's great. Thanks for letting me know that. Now, has there been any period of time where you perhaps did any recreational drugs? Well, actually, yes, doctor. And he goes on to explain. That's more likely, right? So that's the G. Now, the N stands for neglect. Sometimes the patient is not aware enough that a problem with maybe her menstrual cycle could actually be an issue, and in turn, she'll never mention it. When you signpost here and let her know that it could actually be related, it's a heads up for her to think of any minor problems she might have neglected that could be significant to you. Okay, now how do we signpost the right way? Well, of course, everyone has their own way of expressing themselves, and I personally always discourage the use of stock phrases, because frankly, they don't come out as naturally from one person to another. The idea is to just inform the patient that you'll be asking a series of questions that might seem unrelated, but remember, it's not to take permission from him. This is misperception number 1 about signposting. Some people think it's more polite to take permission from the patient before going on with a conversation. For example, they'd say, may I ask you some questions about your sexual life? No, guys. I mean, to begin with, that just sounds weird, right? The fact that the patient came to you for a consultation means you already have permission to ask him all the questions that might lead you to a diagnosis. All you need to do is inform them if there's any personal inquiries coming up, just so they're not taken by surprise, that's all. Now, the right way to do this is to say, for example, I'm going to ask you a couple of questions about your lifestyle, okay? Or, the upcoming questions might seem a bit personal, but they're related to your condition. That's more appropriate. It's not a question, it's a statement. Now, on to misperception number 2. Where do you need to signpost? Now, it has been established through ages of OSCE practice that you're supposed to signpost right before every segment of your history. So, before your present history, you'd say, let me ask you further questions about that headache you have. Then, before past medical history, I'm going to ask you some questions about your medical history now. Then, before personal history, and the menstrual, and the sexual, and the occupational, and so on. Well, that's fine, but again, why? Why would a patient be alarmed if you're asking about any medications he's been on, or any allergies he's had? That's standard medical talk. You can go through that right away. You don't need an introduction, right? So, in my opinion, signposting before every segment is just, you're overdoing it. It usually means you sound like a robot. You're too repetitive, too formal, and frankly it wastes a whole lot of time that you can make better use of in an OSCE exam. So it is wiser that you signpost only when relevant, and by relevant, I mean that you're approaching a personal issue. So it makes sense to do it before you ask about lifestyle, smoking, alcohol, recreational drugs. Now these you can't go for without alarming the patient because otherwise they'll probably hesitate to give you a straight answer, right? I mean, why are you asking me about my life? So number 1, I'm going to ask you a couple of questions about your lifestyle that might be related to your condition. Do you smoke? And so on. Polite, but to the point. Number 2, before sexual or menstrual history, which might be a bit of a sensitive area for some people. Maybe start with, the questions I'm about to ask you might seem a bit personal, but they're essential for me to get a fuller picture of your condition, okay? And you wait for a nod from the patient first, just out of courtesy, don't be too blunt. Then, you go on, are you sexually active? And so on. See how smoothly that goes? And finally, number 3, when the station itself starts off with a sensitive issue, and you know for a fact that most of your questions might be quite personal, like for example, in preconception counseling, or in a station with perhaps HIV. To save yourself the hustle, you could signpost at the very beginning and give a general idea where this conversation might be heading. And then you just hop on that. So from the beginning, you can say, okay, Michelle, throughout this conversation, I might need to ask you a couple of questions that might seem a bit personal, but they're important for me to thoroughly assess your condition. And then you ask everything you need. You've built yourself a wall to lean on. She won't feel weird answering any of your questions. That's it. So, in my opinion, these are the only 3 segments that need signposting, before lifestyle, sexual, and menstrual history. Otherwise, don't tie yourself up with unnatural expressions. The whole idea is to be polite and easy to approach so the patient gets comfortable talking to you. That will be the end of today's episode. Stay tuned for live role plays where you actually see how something as simple as signposting might push candidates the wrong way in.